Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 233-3024 to find out how you get your simple digital eye screening done. Remember, BARB members get 15% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Good morning, Larry, and good morning to all the VOB listeners who are tuned in. Hope you are having a spectacular, sugar-free morning. And if you don't know why it should be sugar-free, you need to listen to this show. This is Peter Boyce here. Welcome to everyone as the Barbados Diabetic Eye Screening Program, in partnership with BARB and the Maria Holder Diabetes Center, sponsors this eye-opening 15 minutes on VOB 92.9 FM. And it's called eye-opening for a reason, because we'll be revealing some diabetic facts that you might not have known, and also some that you might have heard but you need reminding about. And it's also eye-opening because we'll be highlighting the features of the Barbados Diabetic Eye Screening Program, which is on at the Maria Holder Diabetes Center. They are located in Warren, St. Michael, there by Price Smart, right by Eunice Gibson Polyclinic in Warrens. That's where you can find them. So today, we'll be hearing from Dr. Charles Pierce, who's in charge of that program, and also from some behind-the-scenes persons who work with the screening program on exactly how your eyes benefit. And we will also have Dr. Diane Bradford popping in as well. So if you have diabetes, you need to listen to this show. If you know someone who has diabetes that you care about, you also need to listen. And if you don't have it, you don't want to get it, even more reason for you to stay tuned. So we're going to start this show right off today by going to the telephone line. And we have a caller who has a question for Dr. Bradford. Go ahead, caller.
Hello. My question is for Dr. Bradford. What's the difference between type 1 and type 2 diabetes?
Hi, good day. Thanks again for having me. Okay, so we're talking about diabetes or mellitus. So remember, this is a condition where when there is either not enough insulin in the body or the insulin that's being produced is not working, and therefore the levels of the glucose, or what people call sugar, build up in the blood. So when you have the type 1 diabetes, it means that the body is not able to produce insulin at all. Whereas when you have type 2 diabetes, you're able to produce insulin, but the insulin doesn't function properly, and therefore the sugar still builds up in the bloodstream in the same way, but it's not because of an absence of the insulin, it's because the insulin doesn't work properly. So type 1, that tends to be more common, in children, but it can occur in adults as well. And a lot of the times it tends to have a more what we call a rapid onset. And the person can actually present like being very unwell. Sometimes some of the children may present in something called diabetic ketoacidosis, where they're really unwell and they may have tummy pain and vomiting and very high blood sugars, weight loss. It doesn't always present like that, but the blood sugars tend to build up quite quickly because you're not producing insulin. And if you think in contrast, type 2 can be quite different because you can actually have type 2 diabetes for a long time and not know you have it, because the sugars can build up a slower kind of rate, because sometimes the way in which the insulin dysfunctions or how it happens at a lower rate or a different rate, or it's a different condition really. So sometimes you don't have any symptoms because of type 2 diabetes. I always tell people the most common symptom of type 2 diabetes is nothing, but when the sugars get high enough, you can get things such as like numbness in the feet. You can have changes in your vision. You can get infections, pass water very frequently, itchy skin, weight loss. Sometimes people get increased appetite, thirst, headache. So the two of them, when the sugars are very high, I'm going to have similar symptoms, but they're different kind of causes.
And now we are going to focus on a person who works behind the scenes at the Maria Holder Diabetes Center. We welcome Miss Renee Griffith.
Thank you.
What is it that you do at the Diabetes Center?
Okay, I make bookings for the patients to come to have their eyes screened, and I also help take the pictures of the patient's eyes when they reach.
So you are a photographer, but you don't take pictures at weddings, you take pictures of eyes.
Yes, I do.
And why would one want to take a picture of only a person's eyes?
To see what is actually going on with the eyes, any signs of changes that will be going on in the eyes.
And when you take the photograph, what is it exactly that you're looking for?
We are looking for diabetic retinopathy, which is something something that you find in diabetic patients, bleeding going on to the back of the eyes or the detachment of the retina.
You were able to take a picture of the back of the eyes as well?
Yes, we do.
So after you take the photographs, Renee, what do you do with them?
Okay, we take the photograph, myself and my colleague Dominic Brathwaite. After we take the photographs, we email them to the graders. We have 2 graders. We email them to the graders. They review them, and then the doctor will have a look at them. They come back to us, and we call the patients with the results. Depending on the results, if it is a serious case, then they come in and they speak to the doctor one-on-one. That's basically it.
So Renee, do you find what you do to be exciting?
Yes, to be honest, it is a very new, exciting venture for me, because not only that you get to see patients, but for me personally, it actually opened my eyes, because I never knew that there was something called retinopathy, furthermore, diabetic retinopathy. And working here at the Diabetes Foundation in the eye screening program, I have seen many different eyes, many different pictures of the eyes, and it is a serious thing. It also teaches us that we should take care of our eyes more, be very, very protective, because it's serious. Losing your eyesight or having not being able to see or glimpse, seeing patients not being able to read charts due to diabetic retinopathy is not a good feeling.
But you are able to participate in helping to get that corrected.
Yes, thank God for that. And I am also glad to be part of a wonderful team that's out there trying to save eyes and also save lives. And I would advise anyone out there and everyone out there who has diabetes to come and have your eyes tested.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 233-3024 to find out how you get your simple digital eye screening done. Remember, BART members get 15% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
We have with us Dr. Charles Pierce. Welcome to the show, Dr. Pierce.
Thanks very much.
What is the advantage of digital screening over regular clinical reviews?
So the main advantages are that you can look at the photograph and you can manipulate that image. So you can magnify it, you can change the background color, and all of this allows you to see if there are very subtle changes that are happening at the back of the eye. The other main advantage, you have a record of the image and you compare that to and see if there's any sign of progression over the years. So if you do notice that there are any changes starting to happen, then you can intervene earlier and make that difference to prevent further vision loss.
So why does the Maria Holder Diabetes Center continue to screen, and what is the scale of the diabetic eye disease problem?
Well, there is a significant impact from diabetic eye disease in the general population in Barbados. So you notice, unfortunately, that a lot of people who are attending clinic, they're coming at a stage where there's a significant loss of vision. So they're not picking up the early changes where you can intervene quicker and prevent this vision loss from happening. So what we want to do with the screening project is pick up these earlier changes and make a significant intervention to prevent long-term loss of vision.
What impact does this eye screening program have on the public sector?
So in the last 2 years, with the impact of COVID, we're moving away from a lot of these face-to-face clinical visits to more teleophthalmology and virtual settings. So what happens is that, unfortunately, when you go to the QEH, because of the large number of patients that need to be seen, you can spend quite a long time waiting to be seen, and there can sometimes be a delay in terms of your appointments. What we're hoping to do with the Maria Holder Diabetes Center is patients that are accessible for screening, they can be seen there, and we can do their photographs, interpret the images, and decide if they need to have treatment or not. If you do need to have treatment, then we can refer you to the QEH or wherever is appropriate for that treatment to take place.
What plans do you have for the future in terms of regional cooperation or research?
We have quite a few plans in the pipeline. time. We've already partnered with United Kingdom Diabetic retinopathy screening programs, and we're planning to set up a regional network of other centres involving countries such as Dominica, Trinidad, Jamaica, and hopefully having this larger volume, we'll be able to do more research, apply for more regional funding, and develop the entire system for the benefit of people across the region.
We now go to a lady who has experienced the Barbados eye screening program.
Well, I found the service is very good, and I would advise anyone who is a diabetic, give it a try because it definitely do work. Once you follow the plan and you follow what you're supposed to do, yes, it can improve your eyesight, and yes, it do work. It can work for you. It is very extremely helpful because, as I said, when they first went into the plan, yes, they saw your doctor, but they didn't only just stop there on concentrating on the eyes. I had a nutritionist that taught me the right way to eat. I think this a physical therapist. I also was taught, as I said, the right way to eat. The portions that you do put on your plate is very important, and there was a chart that was given for me to follow. They just didn't tell me. They also give me documentation, proven documentation. I had pamphlet, everything that I cannot follow, so I wouldn't get off track or go astray and do my own thing. So yes.
If you were going to rate the screening program between 1 to 5 stars, how many stars would you give them?
I would give them their full 5 stars to deserve it.
The Maria Holder Diabetes Center, with their diabetic eye screening program, offers a standard of service that equals or surpasses any you might receive internationally. So if you are diabetic and listening to your radio right now, you need to make an appointment and get your eyes screened. You can reach them by calling 417-0305 or 233-3024 to make that appointment. The last 15 minutes you heard on your radio was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with BARP and the Maria Holder Diabetes Center. Until next time, take care of your eyes.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 233-3024 to find out how you get your simple digital eye screening done. Remember, BARP members get 15% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.